Martin Munson is 83 years young, and like many people his age, he's had his ups and downs when it comes to health. Most recently, Martin had a stent placed in his carotid artery.
And I'm not aware of it at all. It's wonderful.
Wonderful because this little device potentially saved his life. Martin is one of millions of Americans at risk for a stroke because of narrowing of the arteries. But more and more doctors are using stents to hold the carotid artery open and prevent a stroke from ever happening. A stent is a durable metal device that's crimped and compressed inside a catheter, waiting to be deployed inside the artery.
And this is what would be happening within the artery as I do that.
Dr. Mason Weiss is an interventional cardiologist at the Tommy Lasorda Heart Institute at Centinela Freeman Regional Medical Center in Inglewood, California, and he's also Martin's doctor.
The advantage of the stent is that we do it percutaneously or from the skin, and the procedure is all done from the inside so that there's actually no incision.
And there are a lot of other advantages, especially when you compare the stent to the alternative method of preventing a stroke, which is surgery. With surgery, the patient is in the operating room for several hours while doctors remove the blockage in the artery. They're in the hospital for several days, and that's followed by several weeks of healing time for the incision. But with the stent,
basically an hour for the procedure and one night stay in the hospital.
And no general anesthesia. In fact,
we actually give them a little rubber ducky in their hand on the opposite side of the brain that we're working on, and routinely ask them to squeeze it so that we can make sure that our commands are being heard by the patient.
But there's something else that makes the procedure less risky. It's this little device referred to as distal protection, and it does just that, protect the patient.
Think of it as a catcher's mitt. We place a little catcher's mitt above the artery where we're working, so that when we put the stent inside the artery, anything that we knock loose is catched by the catcher's mitt, and then we extract that out, and it never actually goes headward to the brain.
But is the stent as good as having surgery?
Results long-term have been excellent. Comparing surgery versus the stent, they're equally effective.
In fact, the stent is considered far safer, particularly for patients considered at high risk for surgery because of other health issues. How did Martin fare?
Not eventful at all. No pain. I just sat there, stayed in the hospital a very short time, and went on normally.
Here's a look at the arteries in the brain of another patient when there was a blockage. And here's a look after the blockage was removed and the stent put in place. A dramatic difference. So how did Dr. Weiss find Martin's blockage in the first place? Well, it began here as part of a routine exam. Martin had a CT scan.
Kind of close your eyes for me.
The CT scan, or CAT scan, stands for Computerized Axial Tomography Scan, and it's revolutionized how patients are diagnosed. This 64-slice scan is an X-ray procedure along with a computer that combines several hundred images per second to generate cross-sectional and three-dimensional views inside the body, like you see here. Simply amazing.
We can actually make a diagnosis of where the blockage is and how severe it is totally non-invasively by just having an IV injection, and within 10 minutes after taking the study we can have beautiful 3D rendered images of the arteries.
But people can be on the lookout for signs of a stroke on their own. Some of the more common stroke symptoms include problems with vision and speech, dizziness, weakness in the arms or legs, and numbness in the arms or legs. So who's at risk for a stroke? Well, anyone who's also at risk for heart disease. That includes anyone with high blood pressure, diabetes, high cholesterol, a family history of heart disease, and smokers. As for Martin Munson, he says he's grateful for a good life and now good health. He says he credits a great hospital and doctors for looking after him. And yes, he also credits a loving wife of more than 50 years who does the same.
She just reminds me I do what I'm supposed to do. She certainly does that in a wonderful manner.